Number 4. RDW, red cell distribution width. The red cell distribution width blood test measures the amount of red blood cell variations in volume and size. RDW may be used to quantitative anisocytosis in blood film. Purpose of RDW. This parameters is used to evaluate the types of anemia and other health conditions like thalassemia, liver disease, cancer, and inherited disease that can cause severe anemia.
Types of RDW. Number 1 RDW-CV. Coefficient of variance. Number 2 RDW-SD. Standard deviation. Normal value of RDW-CV and RDW-SD. RDW-SD in femtoliter 40 to 55 femtoliter, FL. RDW-CV in percentage. 11.5% to 15%. Specimen collection. Collect 3 to 5 milliliters blood in EDTA tube. Cause of high RDW. Number 1. Iron, folate, vitamin B12 deficiency. Number 2. A high MCV with a high RDW occurs in some macrocytic anemias. This can be due to a deficiency of folate or vitamin B12. Number 3. A low MCV with a high RDW occurs in microcytic anemias. Iron deficiency anemia is a common cause of microcytic anemias. Health condition with normal of RDW. Number 1. Normal RDW with a low MCV. You may have an anemia resulting from thalassemia or a chronic disease such as that caused by chronic kidney disease. Number 2. If your RDW result is normal but you have a high MCV, alcoholism or liver disease.
Number 5. Hemoglobin test, HB. Hemoglobin is the intracellular protein present inside the red blood cells. Hemoglobin makes the red blood. Structure of hemoglobin. Hemoglobin is made up of heme and globin. Heme portion consists of iron and porphyrin. Globin portion consists of 4 polypeptide chains, 2 alpha and 2 beta.
Functions of hemoglobin. Transport oxygen from lungs to all tissues. It gives red color to the blood. Transport CO2 to lungs for excretion. It maintain blood pH. Diagnostic of hemoglobin. To help diagnose anemia. To help diagnose polycythemia. Evaluates treatment of anemia. To diagnose various blood disorder. To diagnose hereditary hematologic abnormality. Normal value. Men 13 to 18 gmdl. Women 12 to 16 gmdl. Specimen collection. Collect 3 to 5 milliliters blood in EDTA tube. Test will be performed by Sali's method, microlab 300 or automated cell counter. Cause of high hemoglobin. Number 1 polycythemia vera. Number 2 heart failure. Number 3 liver cancer. Number 4 kidney cancer. Number 5 dehydration. Number 6 renal cyst. Number 7 chronic obstructive. Number 8 pulmonary disease. Cause of low hemoglobin. Number 1 blood loss. Number 2 IDA. Number 3 vitamin B12 deficiency. Number 4 folic acid deficiency. Number 5 chronic disease. Number 6 kidney failure. Number 7 bone marrow problem. Number 8 chronic infections. Number 9 leukemia. Number 10 rheumatic fever. Number 11 lymphoma. Number 12 pregnancy. Number 13 splenomegaly. Number 14 hemolytic disorder. Number 6. HCT, hematocrit test, or PCV, packed cell volume. Liquid portion plasma. Solid portion RBCs, WBC, platelets. Number 1. Hematocrit is the proportion of pure red blue cells in whole blood. Number 2. Hematocrit meaning is to separate RBC. Number 3. Hematocrit test measure the only red blood cell mass in whole blood. Number 4. Both hemoglobin and hematocrit values are compared together to assess a wide variety of hematology disorders. Purpose of HCT or PCV. This parameter is used to diagnose polycythemia, dehydration, anemias, leukemia. Normal value of HCT or PCV. HCT in men 40% to 54%. HCT in women 38% to 47%. HCT in children 31% to 41%. Specimen collection. Collect 3 to 5 milliliters blood in EDTA tube.
HCT or PCV calculation. HCT equals MCV multiply RBC count. Divided by 10. HCT equals RBC count divided by 0.3. Cause of high HCT. Number 1 polycythemia vera. Number 2 dehydration. Number 3 lung disease. Number 4 tumor in kidney. Number 5 congenital heart disease. Cause of low HCT. Number 1 leukemia. Number 2 anemia. Number 3 blood loss. Number 4 chronic disease. Number 5 sickle cell anemia. Number 6 bone marrow. Number 7 hyperplasia. Number 7 PCT, plateletcrit test. Plateletcrit is the proportion of pure platelet cells in whole blood. Purpose of PCT. Plateletcrit is an effective screening tool for detecting platelet quantitative abnormalities. Normal value of PCT in blood. 0.22% to 0.25%. Specimen collection. Collect 3 to 5 milliliters blood in EDTA tube. PCT calculation. PCT equals MPV multiply BY platelet count divided BY. 1000. Cause of high PCT in blood. Crohn's disease. Ulcerative colitis. Cause of low PCT in blood. Thrombocytopenia. Number 8. MPV, mean platelet volume. The MPV is the average size of your platelet. When MPV value is high in blood and platelet count is low, it means that the bone marrow is producing platelet fastly due to increased destruction of platelets. Low MPV means your platelets are smaller in size, which means older platelets are in circulation, which means your bone marrow is not producing enough new platelets. Purpose of MPV. This parameters is used to about platelet size, function, and activation. Normal value of MPV. 8.5 to 12 FL, femtoliter. Specimen collection. Collect 3 to 5 milliliters blood in EDTA tube. MPV calculation. MPV equals plateletcrit multiply PCT. Divided. Platelet count. Cause of high MPV. Number 1 hyperthyroidism. Number 2 heart disease. Number 3 atrial fibrillation. Number 4 diabetes mellitus. Number 5. High blood pressure. Number 6. Stroke. Number 7. Vitamin D deficiency. Number 8. Cancer. Number 9. Hypothyroidism. Cause of low MPV. Number 1 aplastic anemia. Number 2 inflammatory bowel disease. Number 3 cytotoxic chemotherapy. Number 4 enlarged spleen. Number 5 IDA. Number 6 Crohn's disease. Number 7 ulcerative colitis. Number 8 thrombocytosis. Number 9. PDW, platelet distribution width. Number 1. PDW shows the variability of platelet size and used to be an indicator of platelet function and platelet activation. Number 2. A normal PDW indicates that platelets are mostly the same size. Number 3. A high PDW means that platelet size varies greatly. Normal value of PDW. PDW 8.3% to 56.6%. PDW 8.1% to 25%. Specimen collection. Collect 3 to 5 milliliters blood in EDTA tube. Cause of high PDW. Number 1. High PDW and high MPV indicate malignancy in thyroid. Number 2. High PDW and high MPV indicate inflammation. Number 3. In ITP, idiopathic thrombocytopenia purpura, values of PDW and MPV is high. Number 4. Anemia. Number 5. Cancer. Number 6. Bone marrow disorder. Number 7. Infections. Cause of low PDW. Number 1. Bone marrow disorder. Number 2. Viral infection. Number 3. Cancer. Number 4. Drugs.